Hi, my name is Joe. Welcome to my video. Um, this is a video on I'm post-op 1 week right now I had some rotator cuff surgery done on my left arm, and mostly out of sheer boredom, and maybe if somebody gets some help or a little bit of advice from me. That's really the only reason I'm doing this video. Disclaimer ahead of time, anything I say in this video or any other ones following is not to be construed as gospel. So whatever your surgeons, doctors, physical therapists tell you to do in regards to your particular injury and recovery, you do that. This is just my experience and what I'm doing and how I'm handling it along with my wife. And yeah, that's it. So yeah, 1 week ago today, I went in for surgery. I had rotator cuff, like I said, rotator cuff surgery. I had what was thought to be one tear in the tendon, was actually two. In my particular case, I couldn't get an MRI pre-op to look at it because when I was a teenager back east, my friends and I were in like a BB gun war, and I was shot in the face with a BB gun. And the BB is actually still there, and ever since then, there's no real need to get it out, but now there sort of is in case I ever need to get an MRI. It would be probably a good thing to get this thing out, but they didn't want to take a chance of put me in the MRI machine and have the thing pop out of my eye or whatever, so they did a thing where they injected some dye into my shoulder joint and then put me into a CAT scan machine. And that did reveal at least some kind of tearing in there with the results of the CAT scan. So that was a few months ago. Yada, yada. So yeah, like 1 week ago was when I had the surgery. When I was in pre-op before going in that day, I don't know if this happens every time with every kind of surgery like this, but they gave me what was called a nerve block. And thank the Lord for it, because what it was is by use of an ultrasound machine, looking into my shoulder here and my neck, they actually injected some medicine in there around the nerves going down into my arm, just the way I understand it, which numbed this thing up really good. It was not so much for during the surgery. I think it was more for post-op than anything, because they told me initially that I should expect it to wear off anywhere from 8 to like 16 hours after the surgery was finished, which was actually completed probably around maybe 4:30 afternoon last week on a Friday. To be honest with you, that numbness didn't even begin to start wearing off until a little bit more than 24 hours later. It actually lasted quite a bit. It was initially, I started getting some feeling back into the tips of my fingers, but it was more like a needly type, that tingling, along with itching that felt like it was itching inside my arm and my forearm mostly. That kind of itching where you just want to scratch it so bad, but you can't. You can't even reach it. So that made the second night's sleep kind of almost impossible. But it didn't last too long. The numbness after that through Sunday, all day the Sunday, which was 2 days post-op, it gradually wore off. By Monday, it was pretty much all the way gone. Right now, I have a condition where I actually emailed my surgeon today to ask if it's normal. I'm hoping it's just residual numbness, but I still have like some numbness, and I'm using my right arm as an example, basically on my forearm, from here right around the wrist, extending up the side to just basically in this area, right on the surface. And I'm just kind of curious as whether that's normal or not. I'm hoping it is. Hopefully it ain't anything indicating anything kind of permanent or whatever. So I'm still waiting a response from my surgeon on that. Geez, life post-op. Well, everybody I talk to on a lot of these videos, there's a ton of these videos, and I'm just adding to it. Uh, Said, the pain can be, and people just talking to it, like shoulder pain afterwards can be like so unbearable, and blah blah blah. And I have to be frank, that I honestly haven't felt anything like that. If The things that helped with, I guess, pain management in that regards is, one, the nerve block initially. Two, I was prescribed basically just hydrocodone for the pain management. No, surprisingly, no antibiotics, but from what I understand, my surgeon gave me a really big dose during the surgery, so that wasn't really a factor. From what I see and what my wife sees, as far as the suture or the incision sites are, that everything's like coming along really good. There's no pain or anything like that, no redness indicating an infection or anything like that. So, and actually, the thing that's probably helped the most is, they gave me an ice machine. Now, there's some people that have had the surgery I've seen. One was a lady, I'm not going to mention her name because I don't know what the legality is on YouTube, but she has a whole string of videos on her post-op experience with a rotator cuff tear. She actually had to buy one herself. I think she went on eBay or Amazon or something and bought it used for a pretty good price, and was wondering if I would have to do that. I did not. Luckily, the surgeon, through the medical insurance, I was already hooked up on when I actually woke up post-op. So that thing is kind of really saved my life. It's made by a company called Aircast, and maybe in a later video I'll show you what it is. But basically, it's just a machine with a separate kind of cuff that goes over your shoulder. You can see, picture these, whatever. It wraps around the shoulder. It's connected to this machine. Mine looks like actually kind of like a cooler in a way. It's cylindrical. You put ice and water in it, and at base there's a pump in the lid, and what it does is just pump the water through a hose into the cuff, and it gets nice and cold, not super cold like you got ice directly on the skin, but really good and cold, and it really is, it just does a magnificent job, especially during the night. Issues with sleeping. Actually, probably my best night's sleep was probably maybe either the first night post-op or the third night. The second night, like I said, I had the itching thing going on as the nerve block wore off. Third night was probably my best, and every night since then I've had sort of like an issue, even with the ice machine going on my shoulder. Just, it's just a little bit difficult because of the tightness and just what's going on with this, trying to get comfortable in a nice position to sleep. But I have been sleeping. It's just I don't think not as good as like a normal night's sleep, or just like without the surgery. Again, in regards to sleeping, I think I've watched quite a few videos as well in regards to a lot of people, they recommend, and even maybe a doctor will too. They say one of the things that they purchased specifically because of this issue is they would buy a recliner. Because sleeping in a bed, it just, laying fully backward, fully on their back or on their side or anything like that, laying on your stomach, forget about it. But even just laying on your back, it just puts too much tension on your shoulder as your shoulders relax and go backward. It just causes, pain, So a lot of people recommend a recliner. I was going to get a recliner, but at the last moment, and I was prepared for one. I put the money aside and all this kind of stuff, but at the last moment, I sort of changed my mind because what I have in my house is I have actually a large sectional sofa, and one end of it has a chase, on it. So I thought, why don't I just save the money at first, and if I need it, we can have one brought in. If it doesn't work or if it's not comfortable enough, and luckily, it hasn't been a real problem. It's a little different, getting used to trying to sleep, basically sitting upwards, with just a little bit of lean back. But, I adapt. it's a little, it's not no big deal. It's just a little bit strange. But it's definitely doable. If you have a Chase, you might want to give that a shot before you go out and spend money for a recliner. If not, if you don't have anything like that, then, if that's what you decide to do, go for it. It's your money. Do it if you want to. I'm just saying, for me, this Chase, the section with the Chase on it, seems to work just fine for me. So that saved me a bunch of money. I also had I bought a little side table because the Chase is at the end of the couch. I bought a little side table from a little bit of plug here from a place called Home Goods, where my wife actually works, and it's a nifty little table. It's got like outlets on the back, and 2 USB ports to charge your phone. Very handy. Just put my pills on there, some water, remotes, books, whatever. And it's all right there when I'm situated on the Chase with the shoulder attachment for the ice machine on my shoulder. So I don't have to get up or anything like that. It's just very handy as far as that, and as well as what I've got plugged into this table. Since it's got its own outlet, you got to plug the table in, and then you have like 2 outlets. I bought at the recommendation of a coworker of my wife. She recommended a smart plug because my surgeon on his post-op order told or said to use this ice machine with the cuff on my shoulder, at least initially, 30 minutes on, 30 minutes off. It was like 30 minutes per hour, so you do the math. So I bought this thing actually on the way back home from the surgery, which is probably about 7:30 at night or 8 o'clock at night. I was lucid by that time, and I thought it would be a little bit easier to set up. It wasn't easy to set up. I had problems setting this thing up through the app on the phone that recommend to, and by 2 hours of messing with it after getting home, the night of this, I just gave up and said, forget about it. So what my dear wife did that night is, one, I'm going to give a shout out to my wife right now for the support that she's given me through this whole thing. She's laying over there, like, watching me do this and trying not to laugh too hard. But what she's done, and I think, well, she thought she knew she would do this, but she didn't tell me pre-op, is that I was under expectation with this whole experience. I'd be sleeping out here on the couch, and she'd be sleeping in the bedroom in the bed. She hasn't slept in that bed since that first night. She's stayed every night out on this couch, and I think she's going to probably stay out here sleeping with me until I end up back in that bed myself. So I've got such a wonderful Proverbs 31 type wife. I always tell her that, and she's just a blessing from heaven to me. So another blessing, she did not even complain about this. That first night, like I said, I couldn't get this smart plug to work. She set her phone every 30 minutes where it would go off. If the machine was on, she'd go up and she'd unplug it. She'd lay back down, set it for 30 minutes later. It would go off. She'd get back up and plug it right back in again. And I know people say, well, why couldn't you do that? Well, I was sort of under the influence still of some painkillers. And if you remember, I said probably the best night's sleep that I had since this surgery, one of them was the first night, and that was probably the reason why. Because I had the nerve block, but I was also really heavily doped up on hydrocodone, and it had been a long day anyway. And I think it was just sheer exhaustion. Whenever her alarm went off, I never heard a one. But this is what she did for me all night long. Finally, the next day, I said, forget about it, called support for this product. And they were able to walk me through on how to actually set it up that way. So now I've got this smart plug, which the ice machine is plugged into, and it's set up to only from 10 o'clock at night to 6 in the morning to actually trigger to turn on at, like, say 10 p.m., which is actually the first time frame, 10 p.m., and shut off at 10:30. and then it'll turn itself back on at 11 and off at 11:30, and so on and so forth through the night. And we don't have to get up. Everything, the smart plug does it all through the app. And so that's another big thing. Another thing I recommend, if you guys have, if you get this thing and you get this kind of surgery and you get an ice machine, or even anything, if it's a knee surgery, because apparently they make not just um, a shoulder attachment or whatever you want to call it, cuff or whatever, for this machine, but they also make one for the knees, and I think they make one for ankles, I believe. But yeah, it's definitely, that thing has been like amazing to have. So other than that, the only other struggle it's been is uh, learning. I was able to take the main bandage off after 3 days and actually get a shower versus, like, I think a sponge bath the first 2 days. Taking a shower is still feeling my way with. My wife still kind of helps me in a bit. Um, I recommend to forget taking a bath. It's definitely going to be a shower. My wife went and bought me, got one of those like loofahs on a stick, just the other day, because I'm trying to learn how to, while this my arm is immobile, to do as much of this on my own as possible, and that really helps. There's videos out there plenty on how to get yourself, dressed, undressed with the shirt. A lot of videos say buy some loose fitting clothes, and there's some people that even go to the lengths of cutting shirts or sweaters and sewing on Velcro straps or buttons down the side and all this kind of stuff, which I thought, am I going to have to do that? And I didn't end up doing it. So this is just a normal shirt for me. It was just going out there, YouTube, and finding videos on how to do this. I mean, that's what they all recommend that, but I don't have a limitless wardrobe of baggy shirts. So I've just learned to deal with what I have, and myself, and I've not had a problem. It's actually it's easier for me actually to put shirts on than to say get on, actually, like say some jean shorts or anything with a button or a zipper. That's actually been more difficult. I've learned how to sort of tie my shoes one-handed, with a little bit of help from this guy. But it's progressing. I'm still very limited with this with the sling. The only time I've been taking it off is for the shower. Other than that, I just it's got to stay immobile. So it's like 6 weeks in this sling. So that's what the doctor ordered, and that's what he's going to get. I don't feel like doing damaging this thing, by accident or whatever, and having to go through this all over again. So so far, so yeah, like that's my 1 week experience. Food, things like that. The soft foods I recommend initially. I don't know if it's the hydrocodone, but which I haven't been really doing that much except at nights. But constipation has been an issue. We bought a over-the-counter stool softener the day before or the morning of, in anticipation of this. And to be perfectly frank, I don't know if it's really helped me all that much. Maybe it's just a particular brand or whatnot. I'm not sure. Today sort of had a little bit of a breakthrough, only because we decided to maybe go the normal route, and I bought myself a nice bag of prunes and some raisins, and I've been trying to, get a little bit more of the fibery stuff in there, and also drinking more water. And I think that might be the ticket for me, myself, and I. So, again, whatever works for you guys out there, have at it. Other than that, I've been out walking a bit. One thing I can't stand doing in a way is just sitting completely still, even with this. So I've been doing some walking around the neighborhood. I haven't had a problem with it. Another individual, they said after like a week or two, they decided to went out and maybe walked around their neighborhood, and they had to stop because almost immediately or not too long after, they just started feeling their shoulder throb and all this kind of stuff. Well, that might be the particular, I don't know. Everybody's different. For me, I have not had that issue. So we're not talking power walking at 3 miles, or 4 miles worth of power walking. Just actually walking around my neighborhood a little bit for about a half hour, I haven't had a problem with. Maybe a little bit of soreness afterwards, but nothing to really write home about. So that's it as far as my first week post-op condition. If any other questions or anything you want me to raise in the upcoming weeks, please feel free to comment on this. You don't have to hit like or anything like that because, to be honest, again, I do not find self-validation in how many people watch this video. I just decided to do it, A, out of boredom, and B, if any of this info helps anybody out there, more power to them. And then good luck with your surgeries. And yeah, I'm going to stagger these things out like 2 weeks and maybe 3 or 4 regular intervals on the progress. By next week, I'll have had my first post-op appointment with my surgeon to see where we're at, and we'll have a better idea. And I'll also, get a little bit more detail on which tendon or which tear there was. He took some pictures of the surgery and actually gave them to me. So I have actual pictures through the arthroscope camera on where the tears were and how he repaired it. And he wrote what the tear was. I think one of them was a supraspinatus. The other one I cannot tell because, I don't know if they teach this in medical school or not, to teach a doctor how to write where you can't read or understand what they wrote. So I'll get a little bit more detail on that, on what the other tear was and anything else. And yeah, I'd like to see you soon.